Hello. Good afternoon. Welcome back from lunch. I hope everyone is awake. Otherwise, there's coffee. There's coffee outside for sale, which you can patronize. Okay, so this afternoon, I am truly honored to be introducing the second keynote speaker for today. Professor Bassirou Bonfoh trained as a veterinarian, but he also holds a PhD in epidemiology. He worked for a while with, I think, the Veterinarians Without Borders, and then worked as a postdoc fellow with the Swiss TPH for about 4 years. And then he moved back to Africa, and worked to establish what we know as the One Health concept right now. I can't even begin to tell you how instrumental he's been trying to bridge the gap between the North and the South, and also to foster South-South collaboration within Africa. What I'm most proud of this gentleman is he is the one who gave me my first break into life back after a PhD in the West. When I finished my training in Tennessee and I moved back to Ghana and was hungrily looking for a job, he interviewed me over Skype. I was about 7 months pregnant then, with my face all puffy. And I told him that, well, this is my situation, and he asked me whether pregnancy was a disease. I said, no, it's not a disease. As long as you be able to deliver on the job that you are applying for, by all means. And so it was part of the...
Merci beaucoup, Lydia. Très belle introduction. Je pensais que tu allais la faire en français. Comment est ton français? Comment est ton français? Okay, good afternoon. What Lydia just said, I could have just stopped my talk asking you some question around what we did. We've just stand here and so thank you very much. As she said, I'm from Togo, and I could have finished my career without knowing what is happening in Ghana. It's just 20 to 25-minute flight from Lomé to Accra. But some of the initiatives gave me this chance to interact directly and indirectly with Ghana, and even beyond Ghana and Togo, from Côte d'Ivoire to East and West Southern Africa. So before I start my talk, I just want to recognize the power of the Deltas program. And I don't know if Kevin Marsh is in this room. Just want to acknowledge his contribution for the design of this program, and also thank Suzanne, she's there, who's really supporting us running the Deltas program. I don't know if Denise is around. Denise? Yeah, thank you very much. As she said, I'm from Centre Suisse de Recherches Scientifiques in Côte d'Ivoire, which is a regional research center. With the name, you may think that it's Swiss, but it's an African institution. We just kept the name Swiss for the branding, because when you hear Swiss, then you don't even ask yourself, you can give money. And I'm the director of the consortium Afrique One, and Afrique One is one of the consortium like WACBIP, and we run that with other 14 fellows. And the 14 fellows of Deltas, I think Gordon is here, they decided to put in my hand hot potatoes. Just to coordinate, I will not say the mess, but the most difficult part of coordinating the health research of 14 brilliant research leaders. And you have heard yesterday with what have been said about Gordon's and his colleagues' work here. So this is what we call ASH, the African Research Consortium on Health Research. I don't know if I have. So what I'm going to talk this afternoon is just to give you an insight of what Deltas has done for the last 6 to, I will say, 10 years, and bring to your attention one of the concepts or the approach we have developed, which is One Health. And I will define that for you to understand. And since yesterday, I have been listening to most of the talk, and when I see what is happening in the lab with nice pictures from the lab, I just ask myself, what's the meaning for a farmer in a village? And what could be the impact of that for a farmer or a woman who is selling food at the market? I don't say that basic science is not important, it's very important, but sometimes we have to stop and see what are the pathways to the impact on the life of people. So everything started for me when I did my DV, and I said, so on which topic? And then I read the application, and they said, you choose the topic that is relevant for Africa. We don't want to guide you on which topic you want to do. This is where I also call Lydia saying, okay, I take you as a postdoc, just tell me what you want to do. I give you money and you can fly. So this was what we call the African Institution Initiative. I will not come back on the reason why research support or capacity building is very important. It was to handle the transition period for young PhDs and to make sure that we build the environment for young researchers who have finished their research to come back. And by that time, the most difficult part of our institution was that we did not have a postdoctoral position in our universities. This was the first time we tried to introduce, and we faced a big challenge at the universities asking us, where do you want us to put those fellows? They are not recruited as assistants, and they are just hanging like bats, if I can say. They are not attached to that. And some of them were saying, no, we want this position. We said, if you want this position, you need to reduce the time of lecture, because this program is for science. You need to take 80% or 90% of your time for science. So this was the big challenge, and we were happy that just after, I think Gordon knows the system to understand how best Africa can be supported. And this is where in 2016, together with the 11 consortium, we decided with the support of the funders to build the ASH, this think tank program that I'm coordinating. So ASH is made of 20 consortia coming from I think 16 to 17 countries, and we have about 100 researchers that are part of this network. But the 14 directors of the consortium form the ASH, and we are established to support all funders, to support all kind of research challenges in Africa, because if you look at the group across Africa, we claim that we have the legitimacy to talk about what is health research in Africa. Just taking work BIP here, if you see the impact of work BIP and you multiply that by 14, you will see how the impact is in in Africa. We also help the funders to understand how, where to target investment and where to build the capacity. And the proof of concept of deltas is to shift the center of gravity of science or research into Africa, but not only research, but the funding mechanism and the management of research. This was the challenge that we had also for the trust from the funders to give this amount of money to African institutions without any good governance system. And then we have to look at areas of building the capacity. The capacity was not only for fellows, but it was also for institution and administration, and especially the financial officers. And you will see later, I will tell you, it's not only science capacity that we need, but we need to build the capacity of other part of the management program. And the model is based, as I said before, on the African defined priorities. What are the main priorities? Supporting institutions and people within the institution, and using also the tools. And if you look at this graph in blue, you see the program looking at different capacity building aspects. And we have some programs who help to develop tools, those programs who are deeply into the health research and health priorities. And this was something very important. And when you look at the 11 or the 14 consortia, you may ask yourself, is there competition among ourselves? But for us, it was not competition. It's to look where we can cross-fertilize, have synergies, and share platform. Sometimes when I'm here and I see fellows from WACBIB, they think that I'm part of WACBIB because of we were just exchanging. And when Gordon go to Côte d'Ivoire or wherever, and the fellows see them with Lydia, they think that we are he's from Afrique One. But for us, being part of one or another is not the important, but how we share resources, how we share skills. This is the most important part of the business. So what have we achieved so far? As I said, we moved from 11 to 14 consortia. And when we look at the figures, in 5 to 6 years, is more than 2,000 fellows trained by the Deltas program in Africa, with more than 1,000 research networks and 5,500 undergraduates. And if you look at the network, you will see how our network is established. And you may see that the challenge is in Central Africa. And that was something Deltas was thinking, and for the current phase, we made possible to embark institutions from Central Africa into the program. It's 1,400 publications that we had. And if we take the funds leverage on top of what we did, each of the consortium mobilized 3 to 4 times the grant. I had 6 million euro for Afrique One as Aspire. And we, at the end of the program, we were around 36 million, because this grant helped us to attract more grant by our fellows. And we have very strong institutions. And what is very important for this program is the balance between sectors and the balance between countries. Because sometimes when you build capacity, an ivory tower of an institution or center of excellence somewhere, and other countries or institutions are not following, it's a big problem. And you see what's happened. I'll just give you the example of Sierra Leone, Liberia, and Guinea with Ebola. Without capacity building in that area, when a disease emerges, you have it on your face. And to tell you, for example, today in Liberia, you have, I think, 1 or 2 vets in that country. Only 2 veterinarians, and they are occupying the high-ranked political position. So in the ground, you don't have people. So you see, if you take that into research, you can have very strong institutions doing research, but if you have weaker institutions or weaker countries, it's a problem. So Delta was trying to establish this network to help. And we have contributed during the COVID, I will not come back to that, how science can contribute to better prepare pandemics. And we had a paper on that. And we have also developed through the case of 4 consortia, how to really monitor and evaluate capacity building. We can monitor and evaluate research, but monitoring and evaluating capacity building was a big challenge, and we tried to put some tools and methods for that with the help of our partners in the North. And that gives us now a very good system of improving the evaluation and setting targets. The challenges level. I remember when Lydia wanted to go to a conference, I think that was the first time I realized that I have to pay for the baby, for the flight. I have to recruit a nanny during the conference for the child there, and I have to squeeze the program so that there are very specific time there that she can work. Just to give you an example. And sometimes funders also focus on the micromanagement, what I call micromanagement. Managing funding, good managing funding is good. But sometimes we forget to think that research evaluation is also very important. And the last thing I want to highlight is the mobility of researchers. Visas. It's a nightmare. And I don't know, maybe Gordon, we need to do something. We have been talking about that. This is where we need institutions like ECOWAS or African Union to help. I cannot understand that if I want to go to Kenya today, I have to take 2 weeks of application of visa, not knowing if I want to go or not. They cannot call me on emergency on something in a country where I have the skill and I can decide the following day to go. It's happened during COVID and Ebola, where when we wanted to bring East African social scientists to West Africa, it took a lot of time. So those kind of things are challenges, and we need to think of that. And one thing I want, as a mutual learning, is the area of administration overheads. And sometimes we struggle with funders. And the second element is keeping the funding foot in Africa, because we lack science funding mechanism in Africa, and we still depend on external funding. And what I want to highlight here is the freedom to look at or to address African priorities, and especially health problems that Africans face. And now I am going to tell you the example of the One Health approach that I sold in 2008 when I was applying for that grant. So the One Health approach and how it can help the fellows here and even practitioners. So One Health approach, if you look at Africa today, we have more than 100 epidemics, outbreaks ongoing. I don't know if in Ghana here you have the one dengue. Do you have dengue here? Ongoing dengue. So what are we doing on dengue? And you look at those kind of diseases that we can see, we listen, but there are others that we don't even look at. Food poisoning, antimicrobial resistance, malnutrition, mental health problem, those kind of health that every day affect people are not considered. And if you look at the health threats as a complex system, we have two ways. Either we use our tool, the tools we have in hand, which is not effective. And on top of that, you can also have the different perspectives, how we see the problem. The perspective of the communities, the perspective of natural science, and the perspective of humanities. So the most important things that One Health address is the collaboration between sectors, between disciplines, and then looking at the knowledge generated by this system to transform the knowledge with the contribution of the communities. So this is what we call the transdisciplinary approach. And why One Health? Because we see that if you look at the biology, you look at the physiology, you look at the pathology, human and animal share the same ecosystem. And there's no difference of paradigm between the physiology or biology of human or animal. They share the same pathology. And if we want to handle some of the diseases, we have to look at both sides to understand the issue. Then we ask ourselves 4 main questions. And the first one is how those threats emerge, and how, for example, the pandemics are fabric, and what is the cost of those pandemics or outbreak on the the livelihood of people. And the third question is, what is the capacity of our institution, our health system, to handle them? And the fourth question, do we have innovative solutions or approaches to address them? And if we look at the emerging diseases, some of the diseases from animal to human, we can definitely see that it's possible to handle them in the livestock sector to prevent human health. And I give you this example so that you see. This man is a physician. We were working in the northern of Mali. And if you want to look at the health of this child on the medical perspective, it's okay. And then another component will be, what will be the behavior of this woman to accept the type of medication you bring for the family. You can stop there. But with the One Health concept or approach, you can understand the health of this child by looking at the livestock, the source of their nutrition, which is milk. And some will stop with the nutrition, but those will go even far away looking at the grass available for livestock, which increase the milk production. So if you want to look at the health of this population, this pastoral population, and you only look at the child, you will miss a lot. So it's important to look at the global perspective of the environment of the patient, because everything is interlinked. Then comes to the failure to look at this holistic approach. You fail to look at this holistic approach, and if you look at the incidence cost with the time, this red curve, you will see that when an outbreak emerges, the cost is very high. We have estimation on that. If you look at Ebola, if you look at COVID-19, the cost of COVID-19 was very high, but it was possible in the wildlife sector, in the domestic animal sector, to make a surveillance and detect and respond quickly. If that was done, we could have reduced the cost. And the objective of the One Health is to flatten this red economic costs by using different mechanisms. We have the International Health Regulation that sets 19 priorities, the performance of veterinary services, and then looking at the condition with our contact with wildlife and the wash area to prevent the disease before it becomes a big problem. And I give you an example. Since we are here in WACBIP, you work on AMR, antimicrobial resistance. And if you take a chicken, I think we had at lunch chicken. And if you take one chicken sold in the restaurant, the farmer gets from the price you have on the chicken in the market, the farmer gets 13% of the share. 13% of the share. But who do we ask to make effort to reduce antimicrobial use? Is the farmer. So if you put a social scientist there, what will be the willingness or the motivation of this farmer to prevent the health of people at the expense of his or her business? This is where the challenge is. The same thing happened with milk. Look at what farmers get from 1 liter of milk per day. This is the case in Mali. And if that farmer uses antibiotics in 1 or 2 cows in the farm, and you ask the person to not use or sell this milk, if you have 5 liter or 10 liter per day, you see the amount of money the person will lose. So bringing this perspective to the problem will help to see how best we can improve the condition, the livelihood of people in order to protect the human health. And One Health is really relevant to Africa due to lack of resources, and we have demonstrated through different studies that you gain 14 out of 1 investment in using One Health. And one of the main problem now, if we take rabies, we know that rabies vaccine is effective, very good vaccine. It can protect, we can stop the transmission of rabies by vaccinating up to 70% of dogs. But now the problem is not in science, it's in decision. So we can move from the social science up to the political level on decision, how to make decision on, and I can give you more example on the added value of the One Health. So this is also one illustration of One Health. I brought this from Jürg Usinger from Swiss TPH. You see how our health system function with mass drug administration every year. It's good for business to sell the drugs, but all the time, every year, people get reinfested. So what do? Do you only rely on mass drug administration, or you need to add sanitation, good quality water? So those kind of things we are improving. And with that, we have trained many fellows in One Health, and we have a massive open online course on One Health you can attend. Every year we organize that in October, and you can attend this course with coaching in October, but out of October you can still attend, and but without coaching. And we can get a certificate at the end of the training. My last message is this picture. The first one representing, I will say, maybe fellows who want to capture everything. We are not really focused. We need to focus. And it also represents researchers in Africa. If you are a researcher, it's not like in Europe you have your lab and you know what to do. In Africa, you have to handle administration, you have to handle social life of people, you have to handle many, many other things. This is a researcher. And at the end, they will evaluate what is your impact in science. And the second message is supporting women in science. This capacity building is also there. When the women are showing their steps to grow, we need to look at social barriers that are really bringing them and breaking the glass ceiling. And the last one, I don't know if you realize, the seniors sometimes are not very good in helping younger ones to grow. This, Gordon, am I right? Sorry. I missed the acknowledgement. This one is very important. What happened? The last slide. Okay, I will leave you with the conclusion, is this one. Those are the champions. I think Gordon is our leader in this. I'm coordinating, but we know that when we look how things goes, is the real leader, and I thank you very much for inviting us to here.
Thank you very much. Thank you very much for that wonderful keynote talk. In fact, when he was talking, two things came to my mind. The first one, for those who are biochemists here, is a signal transduction cascade, right? Phosphorylation and dephosphorylation. One small grant opportunity from deltas, or should I say one big, has evolved to something massive. And now we have this arch platform, which is fantastic. And the second thing is really about the crosstalk between disciplines when we are conducting the kind of research that we do. We tend to focus too narrowly on only the area that we are more important, should I say, intellectual in. But I think we need to start talking across disciplines and formulating our research questions more broadly, so that when we are done, we'll be able to communicate the science that we have done to the right people who need to hear it, whether it's policymakers or even the communities or even educators. So with that, I think I would like to open the floor for questions. We have some time for questions. Yes, at the back.
Yeah, sorry. Thank you very much. So I believe you spoke on capacity building, but are you also looking beyond capacity building, transferability in science research? So beyond just doing the research and bringing the research to life, are you also looking at that? You also spoke on a bit on communication, science communication. There are times that I've interacted with people and then they complain that, scientists, the way we explain things to the communities, the lay people, it's a bit technical. So what advice would you give to like young upcoming scientists in that regard?
Thank you very much. Very good question. I went very quickly. This is part of what we call the soft skills. But beyond the soft skill, we have one scientific foundation of One Health is the transdisciplinarity. What we do, and sometimes we have problem with funders on that aspect. When you recruit a fellow in Afrique One, the first thing we do, I think we have Afrique One fellows here, some of them are here. The first thing we do is tell you, go to the target population, not only the communities, but those who are going to take your research, like the national program. If you are working on TB, you need to go to the TB program and talk to them, talk to the communities. This is the starting point. Don't wait until you finish to start engaging them. And there's in Delta's program, what they call capacity community engagement grant that they put on top of the Delta's initiative. But in our program, Afrique One, we already have that, which sometimes is not seen as purely science, but which help for policy and communities to take what you bring. If you wait until the end and you come with your result, the probability that is taken is very, very low. And we know the adoption rate of any innovation, the adoption rate is very poor. So if you want to increase the adoption rate, is at the beginning you have to set the research question with the people. And the second aspect of what we call transdisciplinarity is when you work with other disciplines and you generate knowledge. You generate knowledge from biologists, from chemists, from whoever, and you have a scientific knowledge. The second step is to put that knowledge into the community so that you take also the communities or the decision.
And also that WACB epitomizes. In your experience, is this culture widespread at the moment? That's my first question. And secondly is that for Africans in diaspora who are still thinking of some way of engaging with back home, are there other avenues aside the Delta program and others? Are there other avenues where that's available at the moment for those who are still contemplating coming back? Thank you.
Yeah, it just remind me one researcher in Switzerland saying, I want to work in an area where there's no malaria. And I said, in Ivory Coast, there's nowhere you can have yeah. So we have problem. The context of Africa is problem, we know. We also have potential. But here what we advise, nobody will at the beginning country, but I came back and I started setting my One Health lab. And you see, ask today. I don't know which country to take. I just take my country that I love, like Ghana, but I'm in Ghana, I will not say that. If you ask the Malian government where to put money, and you put research and to buy arms, what are they going to choose? I think it's the priorities, but it's our responsibility to show that science can help to handle some of the problems. And we need to show them also, or to discuss with them on different mechanisms of funding. For example, in Côte d'Ivoire, we have tried, I was explaining to Kevin Marsh yesterday, we tried to set up a national science foundation. What do? We had the debt given back from Switzerland to Côte d'Ivoire. And we said, okay, we want one share for science. And they said, no, we cannot prove that this money will really yield development. And we said, okay, we want this money, but it's your own money, and we have we put it as an endowment fund. And the interest that is generated every year is used to enroll 16 to 20 fellows, masters and PhD fellows in the country. And after 10 years, when we have evaluated, the country realized that the number of fellows we are training is gaining in momentum. And when we had the evaluation, the Ivorian government decided to put another $12 million into that. So doubling the portfolio of this grant. And then we have now an established science foundation where we ask funders to put money into that pot, but not diversifying it. And we call it what the wedding gift scenario. Do you know that? If you are having a wedding and you ask people to bring you gift, you may end with maybe 10 coffee machines. But if you have a list in the shop, when somebody pick a coffee machine, so you'll have to choose something else. So we have to bring funders to choose areas where we still have problem. Money is there, but money is going in the same place.
I think we have time for, just one more question. And the mic is already, okay, well, maybe two. Yes.
All right, good afternoon. Okay, so I'll start with our sister's question about science communication. By way of that, we have a show called Science Digest Show, of which Prof. Gordon Awandare champions for us as well. So we want to say thank you to him. We talk about science and health. We try to demystify science and health over there to the populace. So you can subscribe on YouTube, Science Digest Show. I have a question about collaboration, Prof. Yesterday, Prof. Ernest Aite spoke about collaboration. You also talking about collaboration efforts here. I want to know, how challenging has it been? Could you share some practical experiences about how to go about that so that we can leverage on the strength of each other to push the scientific community forward? Thank you.
I think collaboration is a culture, and we have not been taught how to collaborate. Our academic system is built in a way that we don't talk to each other. Look at how faculties are set up, and sometimes we don't have inter-faculty collaboration. And this is what we are building now in the academia. And my first PhD student who did the work on One Health with collaboration between different sectors, when he wanted to defend the thesis, it was almost rejected because they said it was not science. They don't know from which discipline he was. Those are the kind of things we have as a problem. But it's this kind of research that can solve the society's problem. Not only a single discipline knowledge. A single discipline knowledge cannot solve a problem unless you mix that and then look at the area. And for the communication, I agree with you. We need to learn also how to communicate. But communication starts not on only one way. As I said, it's a transdisciplinary process. It's an iterative process. And I have seen that now there is a big interest of companies, small companies in science communication, which that help to take science to the society. And it's a very big component in our system now. And if you look at how others communicated on COVID-19, they were even stronger than scientists. So we need to make efforts in that.
Whilst we are on the topic of science communication, if you all have your phones, please go to the WACBIB handle. There's actually a graduate student of WACBIB who is a science illustrator at the same time. And for every single talk that you've heard, she has illustrated this very, very beautifully. Take a look at it and please retweet. This is ScienceCom live as it goes on. Good. We have one more question and then I'll end the session.
Thank you, Prof, for your beautiful presentation. My question is related to the last picture. The senior who is cutting the scale to go up, how will he get back? Don't answer that. But what can we do?
How?
Repertoire. Repeat.
Should I repeat?
Yes.
I said the last picture.
Yes.
We had a senior going
who's
up
cutting the steps.
and cutting the steps. I was asking how will he get back when he got all the way to the top. But my reflection point, please.
You know. Thank you.
Prof. Bonfoh, please.
He will fall. He will fall.
That's all. That's very simple.
How can we change the mentoring culture in Africa? It is very important. You're giving funds to us to do research, but we are confronted to very poor mentoring. We have to humanize the mentoring in Africa, and I think each consortium has to take this into account. Thank you.
Yeah, I think it's a good and valid point. We take that into account, and it's part of monitoring and evaluation of capacity building. So being a good scientist, I think yesterday it has came, being a good scientist is not only the number of papers. We want to know how many fellows you have trained. Not only train, what are they doing? And when you move, who are at your back? Or when you retire, who will take over? And sometimes we have some of seniors retiring without anybody taking over. So those are the kind of thing we should put in the evaluation system of research.
Okay, so I'd like us to please acknowledge and thank Professor Bonfoh. Thank you so much.